How to treat fever? Fever is not a diagnosis, it's a mere symptom of plenty of disease. So, first thing in fever, the it should must be recorded fever. More than 100 degree Fahrenheit is called fever. 99.6 is the normal temperature of a person. So, commonest cause of fever, if it is recorded and more than 100 this degree Fahrenheit, you call it fever. Then the commonest cause of fever is respiratory tract infection, so far the children is concerned. And throat infection is by far the commonest cause. Viral infection, it lasts for 2 days to 3 days or so. If it persists more than 3 days, perhaps it is secondary bacterial infection, pharyngitis, pharyngotonsillitis. If you find the respiratory rate a little bit faster and child has cough coming from the chest, mother says, "Look, doctor, my daughter and son is having cough in the and then pain as though it has come from the chest." So it is usually pneumonia. And if you find the fast breathing along with this sort of cough or fever, you have pneumonia diagnosis. So these are the two common causes of fever. And then if they are negative, no throat finding, no fast breathing, no cough, nothing, and your throat is normal, is not inflamed, then you have some other diagnosis. So fever without focal sign, commonly due to the urinary tract infection, and local epidemic of fever, causes of fever like dengue, and then your corona in the last 3 years or so, they are to be kept in mind. At the same time, in our situation, when the fever is of different type, chills with rigor, high grade, and not remitting with the paracetamol, or remitting little bit and then it's going up, continued type of fever, you have enteric fever diagnosis common in this country. In some of the parts of this country, like hill tracts, once upon a time, malaria was quite common. How do they present? They present with the chills and rigor, an intermittent sort of fever. When it comes, it goes very up, and then there's no focal sign again. So, and urinary tract infection is common in the young children. So they are to be kept in mind: dysuria, frequency, urgency, loin tenderness, your the urine culture positivity, and then dipstick positivity, and then inflammatory markers positivity. They diagnose the urinary tract infection. So if the fever persists more than 7 days, yeah, you have this diagnosis. If it goes further, you couldn't reach any diagnosis, but child is febrile, there is no focal sign, you have perhaps three diagnoses. One is the tuberculosis, other second one is collagen disease, third one is malignancy. 30%, 30%, 30% each. And in 10% you are not yet determined, you are not certain about the diagnosis. So they are to be kept in mind. And then investigation over here is essential. You do CBC PBF, you do chest X-ray, MT, gene expert, and of the blood, serum, and then urine, throat, sputum, and then you do the other test, newer test for tuberculosis like IGRA, monospot, and you do investigate for the your malignancy. Collagen disease, if there is appropriate symptoms. Collagen disease symptoms like arthralgia, rash, fever along with it, muscle pain, and then your other system involvement. So that points to the point investigations like JIF in children, the lupus, and then other serological investigations for the collagen disease. Malignancy, they need to be investigated by the imaging and the serological markers. So imaging means X-ray, ultrasound, and at times your CT scan, MRI, and rarely you need to do the biopsy. When you do not have any answer, you have lymph glands, you have the liver mass. You should be biopsy. That should be biopsied, and histology gives the diagnosis. So it's a long journey. You don't need to go to that extent. Common cause of fever in the throat and your sinuses and then respiratory tract. So their diagnosis is clinical. Do not investigate. Go for treating clinically. If patient doesn't remit, fever doesn't remit, then do investigate. And if it is last time patient is too toxic, you need to admit in the hospital. And the pyrexia of unknown origin, PUO, it defines as 2 weeks fever, in hospital admission for 7 days without any definite clue for the underlying cause. As I said earlier, causes are three: tuberculosis, malignancy, and collagen disease.